All right. Well, thank you. Happy Monday. Thanks for joining us for this month's Rural Provider Sustainability. My name is Brooke Snyder. I'm a Workforce and Sustainability Specialist within the Office of Community Living here at HCBS for Healthcare Policy and Financing, where we love our acronyms. And so we're so excited for you to join us today. We have a couple of really great presentations on some supports that might be available to you as rural providers, and we'll have an opportunity to kind of connect and share through an open forum. And we're happy you found us this afternoon. So just a quick overview of our agenda. We'll spend a little bit of time doing some welcome and housekeeping. We'll do some introductions to get an idea of who's with us today and where we're all joining from. And then we have a great presentation from HCBS staff on remote supports. And we'll have an update on direct care careers too, which is another resource here at HCBS that we're happy to share with you about. Some of you might be familiar with it already, but we have had some updates, and so we wanted to make sure that those are connected to you. We'll have time for an open forum where we just get a chance to share and ask questions and network, and then we will close it out towards the end there and share a couple of resources. So with that, let me just do our welcome here. So we are recording. As I mentioned, we do like to post this to our Rural Sustainability website. And so that's just a reminder to avoid sharing protected health information when you're asking questions or engaging. That just ensures we're able to post it out so folks who weren't able to join us in real time are able to still watch it. You're welcome to use the chat. We have several folks here from HCBS who are helping me monitor the chat, ask questions, provide links and resources and things like that. So happy to have you use the chat. We will be posting the slides available with the recording after this meeting, and that will be on the pinned website that is in our chat, that Rural Provider Sustainability website. We'll make sure to post the recording and the slides to that. Typically takes us about 5 to 7 days, business days, just because we do want to make sure that it's accessible for folks, make sure the transcriptions and the closed captioning and everything lines up on the video. So it does take us a bit of time, but that will be posted there for you, likely within a week. If you're listening by phone, welcome. *6 to unmute your line or *9 to raise your hand. We'd love to hear from you. You can turn on closed captioning. It's a little different here in Google Meets than in Zoom, but you should still have the closed captioning button on your Google Meet toolbar for you to be able to turn that on and off. We are transcribing this meeting too, so you might be seeing some transcription pop up as well. And meeting information for this meeting, as well as information on how we got to this meeting, can be found on our Rural Provider Sustainability website. Again, that is pinned in the chat for you to check out. Some great resources on there, also recordings of past meetings. So this is our third meeting of this. We actually had our first back in September. We had a meeting in December, and then this one now. So you can go back and find past recordings if this is your first time joining us and you'd like to catch up. All right, so the purpose of this is really to connect rural healthcare providers through networking, resource sharing, and collaborative problem solving. We really want to foster shared learning and strengthen opportunities for partnership. We have really opened this up to a lot of different Medicaid providers to capture all of those who may be providing services directly, helping connect rural providers, rural members to providers in their areas, or impacted by the availability of services in their communities. And so what started just as home and community-based service providers has really grown over time, because we know in these rural communities you're all interconnected. And so we're just so glad you're joining us today. Just a quick reminder, this is a shared space. So please keep your questions, solutions focused, constructive in our conversations. We really want to make the best of our time together today. And so your cooperation in that is always appreciated. And we're really excited to get started. If we can just do some quick roll call in the chat, that would be super helpful, I think, just to get an idea of who's here. It is a little smaller meeting today than we're used to, and so we do want to get just some idea of representation. So the HCBS staff, other than me, that will be presenting, will introduce themselves as they present, so you'll get a chance to know those folks. But if you wouldn't mind, as an attendee, putting your name, agency, and the counties that you serve in the chat, we can get an idea of who's here today. And I'll give folks just a few minutes to do that. Perfect. Thank you. Thanks for roll calling in with us. We appreciate that. So I'll let folks continue to kind of put those in the chat for us. And you might be wondering, why do we ask this? We really want to understand, again, who's joining us and what voices might be missing, what areas of the state might be missing. We like the idea of connecting you and networking you with other areas of the state, but then also, really importantly, being able to compare quarter over quarter to see how effective our outreach is, to make sure we're getting to the right folks and they're hearing about these opportunities and have the ability to join if they really use this data over and over to just kind of compare and make sure that we're getting folks as needed. All right, so I'm actually going to jump into content, and to do that, I'm going to take us back to December, where we had a question come in during our case management agency Q&A, and a provider was asking, my information is wrong in the Find a Doctor tool. How can I get that updated? So if you're new here, if you haven't used the Find a Doctor tool, it is the Medicaid, our Health First Colorado website, where you can go and select a handful of different Medicaid services and find providers in your area. It is all providers. It's obviously doctors, find a doctor, mental health, home and community-based services, long-term services and supports, all the services within Medicaid. In theory, you can find using this Find a Doctor tool. And so provider had come to the meeting there in December and said, my information's wrong. How do I get that updated? And so we took that back and we wanted to provide an update for you on that. So there is an operational memo from HCBS, which I've linked here, and I'll also drop it in the chat for you. If you give me 1 second. And of course, I didn't have it open and ready, so that is on me. But that's not the link. I'll get it for you in just a second here. But all this to say, from the memo, what they're asking providers to do, if you find an error in your Find a Doctor tool information, you just update it in the provider portal. And so the memo that I just dropped in the chat will take you through how to do that. It actually includes screenshots and all sorts of information on how to do that. Not only can you update like your address and your information, you can also put information about if you are like an LGBTQ friendly provider, or specific counties that you're rendering services in. It gives you some specialization, I would say, and what you want people to be able to find you through on that Find a Doctor tool. So there's a memo there. So if you're having issues with that Find a Doctor information being incorrect, use the provider portal to get that updated. So we just wanted to make sure we close the loop for you on that. All right, so with that, I'm going to hand it over to our first presenter. Casey Wardle's here with us. Casey, I know I'm about 5 minutes early, so unless she comes off camera, so I guess she's ready. So I'm going to quit my share, and Casey, please take it away.
Great. Let me see. Well, welcome. Thank you so much for joining today, and thank you, Brooke, for inviting me. I am the Remote Supports Benefit Specialist. Let me get this. There we go. Here at HCBS, and I have been doing this now. I've took over Remote Supports about 2.5 years ago, and in that time, we've grown from about 1 provider nationally to now we have about 6 providers. So I thought I was really grateful that Brooke invited me, because I think we're at a point where some of our rural providers or some of you guys may be coming in contact with this new service that started in 2021, 2022, and then I rebranded it kind of a little bit in 2024. So if you've not heard of Remote Supports, I think this is a really innovative service that hopefully you'll walk away from today. And then if you have, I'd love to have any input or thoughts or questions. I have about 3 polls, questions of you guys of just out of curiosity about remote supports in rural areas and some of the struggles during that time. I also welcome some questions while we do those polls and we present those. So I'm going to go through some information first. Feel free to put it in the chat, or if you have any questions, feel free to raise your hand during the polls, and then we'll go from there. So what I'm hoping you'll leave with is sort of what remote supports is, and also importantly what it isn't. It's, hint, it's not supposed to replace in-person services. It's not supposed to take over other people, other providers. It can be really auxiliary, a support for remote providers who may already be serving in an area to help members be connected better in between visits. And therefore what it can do for members, why it works, what you need to know as a rural provider, and then kind of some next steps. And if you have some curiosity for further information, how to get that or how to keep in contact with me. So first of all, I kind of, you know better than me, but I just kind of want to highlight things we're aware of, the rural landscape, the rural realities we have, that, between many of our members and our providers, we have long distances, weather delays, workforce shortages, and then also a lot of members may be living alone or far away from family supports, or maybe not being able to connect as much as we want. So I think one thing that we're living in 2026 is a lot of us are using technology to keep connected. And what we want to do is bring that ability to our members so they are able to connect even better. And what we find is that by doing that, we're not necessarily increasing isolation, we're decreasing, we're actually connecting these members up, those who want to use the technology, to better feel safe in living in their home, because that is sort of the purpose of why all of us are here. We really want our members, we want people to live in their homes, be independent, be connected, feeling and living their best life possible. And I think many of us are using technology daily to do that ourselves. Sometimes it's not great, but I think there's parts of it we can understand that are really good. And then if we can highlight that through this remote support service, I think we can really do a good job of supporting members in rural areas, living more independently, living the way they want, and also connecting better with the natural supports they have around them, and also their in-home care. So like I said, independence is the goal. Technology can make that safer and easier. So I'm just kind of what I'm going to go through today more. So I'm going to start with our first poll question. I think, again, this is probably something you have every day, but what is the biggest challenge your agency or, whoever you're with faces in the rural coverage today? So I think, the options are staffing shortages, long drives, gaps between visits, care coordination. So if Brooke wants to launch the first poll question.
And it should be popping up for you. If it doesn't automatically pop up, there's 9 little dots in the bottom right of your screen that you can click on for the polls. And it looks like there's some votes coming in. So
great.
You could probably select all of them, but unfortunately I was only able to do pick your most important. So I apologize.
Well, we probably get all the answers from everyone otherwise.
Yeah.
So it is good. We can do our most important.
And I'll let you know when that stabilizes a bit, Casey, and we'll share out the results.
Sounds great. And anyone have any questions so far or any comments, or should I just keep going? All right, I'm going to just keep going. So what is remote supports? I think, there's a lot of videos out there. If you're really interested in there, you can search it and find some videos. I'm not going to play the videos today because you can find those on your own time. But really what it is it's live. There's key parts of it. It's live two-way coaching. So it's a virtual, there needs to be someone live in one place, and then the member living in their home or their community, in a different location. And so it's virtual supports. I think a lot of ways it's used are maybe a member going to the grocery store, or reminders of getting ready for work in the morning or coming home, or how to cook. So the key part is remote supports doesn't need to be provided only in the home. It can also be provided as members go into their community, usually through a cell phone or a tablet that is cell connected, or and so they can use it and talk to the remote supports provider virtually to help them. What am I grocery shopping for this? Am I seeing something correctly? Oh no, I got lost. I missed my bus. What is my next bus? So there's a, this can be used innovatively as well as on scheduled on demands for medication reminders. And then support cooking, and many other things. So I think one thing to remember when I first started this is that remote supports providers, they don't see themselves as technology providers. They definitely see themselves as service agencies who rely on technology or sensors to help support members living in their homes. In Colorado, in our HCBS services, really the only way within community first choice, there's 3 technology services. There's PERS, the personal emergency response systems, which many members have. Those typically, you it's a push a button, you either can get called emergency or you get called a helpline, but it's typically not for those necessarily help with activities of daily living. It's not necessarily support living, and it's more of like, something's going wrong, I need to talk to someone, or I need to call. And a member can have both of them. So and the other one is medication reminders. Similarly, there can be situations where where remote supports can help with medication reminders if the member just doesn't want to use the machine or doesn't like the actual automated. They need a little bit more hands-on. They want to be seen taking the medicine or checking with someone and saying, hey, these are the medicines I took, or these are so there is a choice here between these 3 community first services, but I think remote supports is the most intense, and also the way to really, for some of these members to access some of these technology devices that really help us just live more independently. So you can have doorbell rings, light sensors, some temperature controlled, voice activated things. You can have, some members are have a necessity need for, GPS, where they want to make sure they're not getting lost. So I think this is our technology part of remote supports. There's a virtual part, and then there's this technology part. Really, we can start thinking more creatively, and really being of what the members need and how to live better. So that's what remote supports is. Keep on the wrong way. I think another key part of it is that remote supports is available throughout Colorado. It really, as long as a member lives in a place where they have cell service or have a way to connect to internet, even if they aren't paying for the cell service or the internet, often the devices that the remote supports technology providers provide within the service can connect automatically up to internet or cell phone. So it really is, it kind of takes that barrier of access away. As I realize there's still, definitely some members who probably don't have cell service or internet service, but even in those cases, there may be some ways we can work with that. So I think this is one big thing to emphasize, is it is available statewide, and right now we have about 6 remote supports providers that can be found on that Find a Doctor tool that are providing services in rural areas, I think, as we speak. So I think I went through some common examples, but here's some other ones. I think coaching and cueing for routines, like I said, getting morning routines, getting ready for work, coming home from work. I know a really good use case is, a 20-year-old who may not want to live at home anymore, but parents are a little concerned that they're going to not get ready for work or not do what they need to do. This is something that if the member chooses, they can set up, and it gives these prompts or these reminders or these call-ins with what remote supports providers, and that takes a little pressure off the parents or the caregivers of, is this, they're not the ones having to do the check-ins or kind of nag their kid in a way. They can rely on someone else to make sure they're having these, and it really does create independence in this separation. So we find a lot of members really love that queuing for morning routines. Like I mentioned, prompts for reminders, cooking support, scheduling transportation, going into the community safely. I think that another use case a lot is happening that we're seeing is fall detection. So using sensors, whether they're and usually I think what's unique about some of our fall detection is they're not wearable, so the member doesn't have to be wearing them. They can, as long as they give permission, they can set up the sensors in their house that just detect that if there's no movement or if they fell, that they'll get an alert and a check-in to make sure they're okay. A lot of these can be on demand, or they can be scheduled check-ins. And then I think another part of this is kind of unique versus in-person care, is there can be some allowances and check-ins for reduced isolation, increasing confidence, like, playing games or connecting up with some of these members virtually is definitely happening. So a big thing of what remote supports is not. So remote supports is not, it's not telehealth, it's not virtual skilled nursing. So it's not a way where we're necessarily providing any medical care, or we're not just, checking in some with telehealth, it is its own it's not a virtual delivery of in-person care. It's a different service model, a different service than what we would consider telehealth or remote virtual care. It's not a replacement, as I said, for needed in-person care. If a member is assessed, they can have both their in-person assessed needs met through in-person care providers, but then, they can also have remote supports if there's, if there's not enough providers, or they want more, they need a little bit more care than maybe they're necessarily being assessed for in their in-person. There could be assessed needs that can be met virtually in a hybrid situation, or it's not an either or. I think, again, much I said, it's not a substitute for emergency services. And really the big thing it's not surveillance. It's not monitoring with consent. We don't allow cameras to be put anywhere just to watch people. That's not allowed. It has to be within the it needs to be key components. It needs to be within the member's control, all the technology. So it's not only that the member chooses and directs the service, the member must control the technology, understand and be able to turn on and off technology, answer things. So it's really this dignity of risk, and then creating independence is not setting up a situation where it's more restrictive. And so therefore we don't have to look, while we have to consider the final settings rule, this is really a chosen member choice on what they're wanting in their house and how they control it. The other part is we can't duplicate in-person services, so they can't be delivered at the same time. If you get a medication reminder through a medication reminder service, you probably shouldn't have medication reminders through remote supports. I think, again, we mentioned hybrid. I think there is a case where, if someone needs a hands-on assistance bathing most of the time, that they can be assessed for that. But then if they need reminders for hygiene, otherwise, that really isn't a duplicate of services, because really the essence of what's being delivered in person is much different than what would be delivered virtually. So one's much coaching and reminders for hygiene, one is the actual doing of it. Much like housekeeping, you might need your house vacuumed by someone once or twice a week, but then you can have cues of like, hey, did you do this, this, and this to keep clean and to do that. So that would be considered a non-duplication of services, where you can, because they're essentially different. One's the actual hands-on, and then there's the one that's more coaching and creating independence that over time may lead to less of those hands-on. I think another part of this is remote backup support is required, because a big risk of remote supports, I'm sure everyone's asking, is like, okay, what happens if the technology goes out, or if it fails, or internet happens? This is when we have a contingency plan, but really it's a backup support plan. And this is where some rural providers who are providing in-person service and maybe want to dip their toes into in some of these virtual cares but aren't ready to go, they can act as part of this backup support plan, especially if they're already in their home, and then the member also has remote supports. It may be that the backup plan is to use the in-person care, and then you can be paid for that as well. Or if there's a neighbor or a family member, the member wants called first in the case of technology fail, then you can have that call down of like, this is the person I want first, and if these three people and this person can't be reached, then we'll call emergency situations. So there's this contingency board backup support plan. And a big thing also is the remote sports providers need to be remote sports providers. It can't just be a home health agency or a licensed care agency or another provider just providing virtual care. It definitely can be only billed by remote support providers. Okay. I think I got a lot. Let's look at the polls, and then we'll go to a little bit more. Did we get a poll result?
From the first one?
Yeah.
Yeah, so it looks like staffing shortages and call-outs were the most reported, followed closely by gaps between visits that create risk, and then high-risk members living alone as well.
Great. And so that in all three of these cases, I think remote supports can be a really interesting solution for some of this workforce shortage. While it's like, ideally the member gets this many hours of care, but maybe there's a way where we can support some of that with virtual care, and really partnering with these virtual care organizations, or maybe even considering becoming one yourself. I know we have some in-home health agencies who are now also providing remote supports. That's a good way of addressing those workforce challenges. I think uniquely remote supports is really good at some of those in between visit supports and care. So if you have a member who, in this world you really think should be maybe need more care than they're getting, this would be a place to think, oh, maybe remote, like they're calling in more often than there should be, or there's a higher need, or you can see some of their natural caregivers are getting tired or exhausted or overwhelmed. This is a place remote supports and remote support providers would be happy and love to come in and support members in some of this in-between care, or some of these care that we know that is happening that may not actually being paid for or assessed for, and so or not happening but actually needs to be happening. Remote supports is a great in hybrid here, and also a great transition part. It can be quickly, yes, Jen, I will. It can also quickly be, in some of our cases, be set up in 3 to, depending on how fast the case management agency connect to the provider, we can get a remote support system set up in 3 to 5 days in a member's home, so if they are getting discharged, at least there's some virtual care and some eyes-on support for the members in these transition situations. I think I kind of went through all this, but I think, sorry, remote supports in 5 steps. Again, key part, member chooses remote supports, the service plan is developed, backup support, scheduling aligns, and then the service begins. So I think, while in a perfect world and theoretically this could happen pretty fast, I think in reality it actually can and can be provided pretty robustly. So this is funded through Community First Choice. So any member who is been assessed for long-term services supports and is on Community First Choice can access remote supports. It's billed, there's 2 separate billing. One is for the technology, which is a monthly, so the remote supports provider can say, well, this member needs sensors for their cooking, or they may want, one of their goals could be, I want to be able to cook by myself, sensors on the bed, and then a tablet, which may be like $150, $200 a month. That is billed separately. And then the actual service is in 15-minute increments, much like personal care is right now. It's just its own coaching code by providers. So it's billed through a PAR. It has to be on a PAR. And the CMA definitely approves it and assesses. And then, yes, so assesses and then puts it on the PAR. And then, the remote supports provider is responsible for providing the remote supports technology. In some states, they have it separated, where they have an assistive technology service, and then they have a remote support service. In Colorado right now, they're connected, that we shouldn't be authorizing remote supports technology unless there's a remote support service or provider in place. And I think and so that's another key part is Class B is not needed. What is needed for remote supports enrollment, we can go through that in a little bit, is basically making sure you have HIPAA compliant ways of working with the member and connecting with the member. So a tablet, and then, basically going through some of our training and then making sure, and then business licenses. So that doesn't need to have it doesn't have to have a Class B. Right.
Casey, this is Brooke. I just want to, just because I'm not sure the chat captures in the recording itself, I just want to go through just the few questions that you answered. So we had someone ask how it's funded. So Casey talked a little bit about how it's funded through CFC there. And then Jennifer asked, the provider is the one providing the equipment. So Casey did address that as well. And she just addressed the is Class B needed. And so those are the questions that we just kind of went through. If you need to, I just want to make sure those were captured on the recording. So thanks so much, Casey.
Yeah, thanks, Brooke. Those were great questions and very time appropriate. So sorry I didn't make it a little bit more clear. I think we kind of got over these, your first person benefits. I mean, for these members, we're really building confidence to live at home in their community, decreasing independence, providing assurance during gaps, and supports for family. I really think this last part, the supports for families and national supports, are a really great part of remote supports too, is that, bringing another person or another service agency to have, to help members feel more independent, have a little bit more eyes on them. If there needs to be some wellness monitoring going on, that can also help happen within remote support. So it takes some of that stress off our natural supports. And that's a key part from a national standpoint that we get feedback from people who really enjoy remote supports, is it like it takes away, they can actually enjoy their family members for being family members, so they can go and have more fun and interact, because some of those stress of the caregiving can be put into the remote supports can take some of that.
And I do just want to shout out Jesse in the chat. I'm a remote support provider. We find that with ongoing regular engagement and monitoring, we can really see changes prior to crisis. It's way more useful than it sounds on the surface. So that's, I think, good real world, like real time feedback, Jesse. So thank you for providing that. That's awesome.
Yeah, I think that's on here, right? I think that's maybe last one. Jessie is one of our great providers, and I definitely used a lot of her material to craft this, and that might have got out of there, but I think it's really that in-between visit and catching things before they become an emergency is just a really important part. So, all right. So poll question 2. So we've kind of gotten through some of these basics of remote supports. Where would remote supports help the people you serve the most? So fall and risk concerns, routine coaching, medication reminders, post-hospital stabilization, isolation, and reassurance. Or I should have, F, other. That's Jesse.
Yeah. Well, and my apologies. I forgot the post-hospital stabilization on the poll. So if that is your response, if you just want to drop that in the chat, we'll make sure that gets captured in the overall poll results. I apologize. I missed that one. Jesse, please.
I actually didn't mean to do that. I was just clicking around. Sorry.
I was quick with it.
But I'll say isolation and reassurance. I didn't get signed up for the poll, but that'll be my answer.
Okay, thank you. And we'll leave that open for a bit, Casey. So,
and are there any questions that I missed? I think I got some of them, but I think we can pause here for a second too. And I talked super fast and went through a lot of this, but does anyone have any questions or anything else in the chat?
No, I think just Jennifer asking about the process of becoming an approved provider, which I know you go into later, Casey. And then Samantha, please, I see your hand.
Sorry, I apologize if you guys already answered this question about to Tom's question about how it's funded, like for a provider. How does that look for an agency?
So if it's an agency or you need to become a remote supports provider for it to be funded. So this is, I think one thing is kind of knowing that this is happening, the services and connecting with members. One way that agencies who are not remote supports providers, it can be funded for would be some of that backup support. Also, if you wanted to consider being a remote supports provider, that would be something, as well as it's funded through our remote supports providers who are enrolled remote supports providers, uniquely providing this virtual support, because it is at an essence different than in-person care. And at one point in time, we kind of had them connected. We sort of separated them because what's needed for the in-person care is different than what's needed virtually. So it's funded through different services, different providers, and then it's at a 15-minute unit. If you are a remote supports provider, or if the member needs it, then they would connect up with a remote supports provider. And I think we have Jesse on here from Journey Care, and then we have about 5 or 6 others statewide enrolled. And then obviously we are enrolling more providers if needed.
Okay, perfect. And then one more question, if that's okay.
Of course.
So just to clarify, and again, I apologize, I think I missed some of the beginning of what you said. So this is almost removing the caregiver in the home because the client doesn't want them in the home. Like it's just giving them that independent. Is that what you're?
Yeah, we're not removing, but yeah, it's giving another option.
Okay,
so
first
it doesn't
having
have to, right. It's not an either or. I think that's one thing to stress, and it's definitely not a substitution. Like, oh, they have to choose either to have in-person care or out of person, right? But it does give an option for an in-between situation where a member may not want as much in-person care, that they don't want someone in their house. This is creating safety if it can't be someone in the house.
Gotcha. Okay, perfect. I just want to make sure. I was like, I don't think it's replacing a caregiver, but I wanted to make sure I was understanding. Okay, perfect.
Yes, please, Jesse, please.
Okay, this time I really did mean to raise my hand. I thought just very quickly, I'll give an example of somebody who's enrolled, and it will take 30 seconds. So this person was given to us from somebody in low-income housing. They've been struggling. They have COPD and asthma, and their oxygen levels or their oxygen requirements have gone up, and she keeps falling out of her wheelchair. So she's fallen out 3 or 4 times over the last week. So not only does she have a referral for in-person support, right? But then they also have us so that way we can be eyes on before that in-person support is there and then during the hours when they're not there. So that's a quick example of somebody who's an excellent candidate, and we engage with that person every single day. The other thing I'll add, and I'm sure you covered this, Casey, is through the CFC benefit. So in really looking at the waivers and community first choice, we spend a lot of time helping people navigate Medicaid. And I'll just leave that there. There are 100 different flavors of how people enter the Medicaid system. And I feel like an enrollment specialist at this point, but it really is incredibly meaningful to help get these folks the help that they need.
Yeah. And then once they're enrolled, really keeping that connected with their case manager. I know we talked about this, Jesse, but a thing for case management agencies is sometimes members will call their case manager lots and lots with questions. And this can also be a place where a signal that this member may need more support than they're actually getting. And this would be also a place where remote supports can be meaningful for these members who may need a little bit more supports that are maybe falling under these, like just what you said, with these service caps. Currently, we don't have any service caps on remote support. So this is a really viable option for these members who, may need a little more support than what they're being assessed for.
And I can share the poll results if you
Let's
want.
do it.
We can wait and do it later.
Let's do it now. That's what we talked about it. And then Jesse jumped ahead of me because all I have left now are 2 case studies. So a little bit more perspective. So.
Perfect. So in the poll results, it looks like you should be able to see them, but just in case you can't, looks like folks are looking for routine coaching with the ADLs and IADLs, isolation and reassurance, medication routine reminders, and then we did have Pat think it's helpful for post-hospital stabilization in that time in between. So
great. Yeah. Okay. Again, there's great, and Jesse probably can speak to more of these, and so kind of our other case providers. But I did want to give a little example of who might be a kind of a good idea or a member who this would be a great fit for. Maria, she's 84. She lives in a rural community, uses a walker. Daughter lives 3 hours away, but she really wants to stay at home, but worries about falls. Plan could include coaching, check-ins, safety tools, such as I said, the doorbell, smart lights, stove sensors, in addition to the fall sensors, some wellness monitoring, and then also this escalation plan and communication between her daughter and her to know that there's, if there's this additional layer of support, making sure that Maria can live at home. I think what changes with remote supports, again, just what Jesse said, there's an earlier awareness, a faster response, and a better coordination when you have this hybrid approach in there. And then the service adjustments can happen sooner, before something becomes a hospitalization. They can be alerted that something needs to change sooner, but also that if there is something that actually happens, she falls, that they can be alerted really fast. Key part, supporting independence with safety, but not replacing this in-person care, which, Maria would still need, I'm sure, for certain things. A second example would be James, who again, post-discharge, staffing gaps, that, recently discharged from hospitalization. We all know that there's a higher risk for those first 30 to 90 days. So you can even have more if you can have more remote supports during these first 30 to 90 days, trying to get their in care stabilized, help the member be used to living at home again, and some of, how their situation may have changed. And you could plan in a step down. You wouldn't necessarily need to, but like whatever the member needs, health monitoring, some of these social check-ins, as I've mentioned, can be done pretty quickly, as the in-person support comes online. All right, so I went through that pretty fast. Last poll, and then I think we have some good questions, and I think we're near time anyways. So, and then I'll go into the basically before I do we can do the poll, but then I'll answer. I think I have how to enroll. So, so the poll question is what would make your agency most confident in offering or using or connecting with remote supports? A clear workflow or backup assessment, understanding the non-duplication rules, training and staff, confidence with privacy consent, or a clear referral implementation pathway. A little bit more. This is a higher level poll question.
And Casey, I can just leave that open for folks if you want to go ahead and go, and then we can check results at the end.
Sounds perfect. So I think I'm not going to go right off the slides here. I'm going to go a little bit of how you enroll as a remote supports provider. So, how rural providers can work with remote supports. The enrollment process is pretty straightforward. If you're already an enrolled provider, you would just go into your provider portal and add the remote support specialty. I can guide you through any of that. So I think because I have the time, if you are interested in doing it, becoming a remote supports provider and enrolling, I would suggest just contacting me. My email's at the end of this presentation, and you can just, or if you go to the remote, if you just type in HCBS remote supports, we have our remote supports webpage, which has a lot of this information, as well as my contact information and also how to enroll as a provider. That would be my suggestion, is to do that. I think most importantly, really, partnering with an enrolled supports provider so you can understand these needs. That would be another one. Really, I said most importantly being the backup support. I think, knowing that there's a members have this coordinated care and this connection between in-person and also these virtual supports will really, it doesn't necessarily need to be competition or taking one thing or another. It can be really member focused on this. So that backup support may be a place, you can consider, dipping your toes in the water of, hey, maybe virtual supports is something we do want to provide. And again, most important, referring members who might be of benefit, to Jesse at Journey for Care, or we have, 4 or 5 other really great providers who, if you are interested, I'm sure would all be willing to present here and give you kind of an information of what makes them unique and how to do that. And then lastly, what we kind of talked about is, consider yourself, considering as a remote provider enrolling. It helps with some of the staffing shortages, long drives, and the aging workforce. All right, I talked really fast, but hopefully you got it. And any questions?
I don't see any in the chat specifically. It sounds like, I don't know if you saw Jesse, but Samantha was wondering if you could connect regarding this and how it's been helpful to your agency. I'll do you one better. And if the group is interested, perhaps in having Jesse and maybe some other providers come to a future meeting and just kind of talk through some of that. If you guys are interested in that, or if that's something that you think would be helpful, just kind of to continue to explore this topic. Seems like there's been a lot of questions. We'd love to do that. So just drop like a yes in the chat or wave at me or something like that. And I can work on getting some of those folks lined up with Casey and Jesse's so glad she joined today, so I could just bring her back.
Yeah, and I think Casey does too, but I think I've got a connection at pretty much most of the others. So I'm happy to broker those connections too, because everyone does kind of have their unique flavors.
That sounds great. Yeah, I think that would be helpful just to kind of dig in a little bit more, perhaps let's see, it'll be June. So Jesse, I'll connect with you. Casey, I'll connect with you, and we'll get some additional information going as well. It looks like Jesse also put her information in the chat. So if you have burning questions and you can't wait till June, I think probably reach out.
Yep, and you can always reach out to me as well as if you have any questions or, about this. Feel free to just email when you can.
Yeah. Tiffany, please, I see your hand.
Hi, what is the pay rate for remote support, especially for CFC services? I know about a year ago we had asked about it, and it was like $10 an hour or something like that, but has that changed?
No, that's about the it's a little bit like $10.20, but essentially $10 an hour, which is how we can offer multiple. So a provider is, you know, working with multiple members at a time, ideally, or the on-call. So, you know, you're not getting a huge reimbursement per hour, but it's more about overtime.
Okay, gotcha. Thank you.
Looks like Daniel would love to connect with you, Casey. So if it's okay, I'm going to go ahead and drop your email in the chat. I know it's on the next slide here, but we'll get folks connected with you.
Please.
Any other questions? Any hands I've missed or anything? Well, Casey, I really appreciate you coming and jumping in here, taking some questions, going through just a ton of information in kind of a truncated amount of time. We really appreciate you. We appreciate Jesse. And I think we really look forward to bringing you back and picking your brain.
Yeah. And if this ever comes up, you have questions, you now know who to contact.
Absolutely.
Thank you all.
Thanks, Casey. And we'll make sure we get a copy of Casey's slides added to the slide deck as well when we get those posted along with the recording. So those will all be there with all the links live and everything. All right. I think at this point, I would like to, instead of pulling up my slides, I would just pull it up and show you the agenda. So instead of doing that, I think I'm just going to let John on our team take it from here to give us some direct care careers, demoing, overview. I'd just like to pull back to Casey's first poll question that one of the things y'all said remote supports would help with is staffing. And so we're happy to bring some workforce resources here that might be able to help out. So John, please.
Thanks, Brooke. Hello, everyone. My name is John Hendricks. I'm the Direct Care Careers Workforce Support Specialist. And what that means is I get to handle everything Direct Care Careers related. Now, if you haven't heard of Direct Care Careers, it is a resource and job hub that is tailored to the needs of Colorado's direct care workforce in home and community-based service waivers, including consumer-directed attendant support services, or CDOS, programs all-inclusive care of the elderly, or PACE, and long-term home health, or LTHH. So within Direct Care Careers, it's free to use. If you're one of those waiver providers, you can access the site. We do have provider verification that you would have to go through to access the site. That's really there to make sure that all of the jobs that are posted are actual jobs and aren't some sort of trolling or anything like that. So we want to keep everyone's safe and information on the site secured. And so we have the employment opportunities for direct care workers. We have direct care worker resumes for agencies, and we have state resources that are on there. All of the resources that are on the website are free. This goes along with the training. So I look for resources weekly and put about 4 new resources on the website every week. And we'll go through that here once we get into the live demo. We also have a smart job matching tool. So basically, once you get online, and if you're an agency and you fill out your information of the worker and, do a job post, you'll automatically be matched with workers in your area who match with language, who match with this type of services that you're looking for on there. So it's a pretty quick matching. Then I'm going to just go ahead and share my screen real quick, and we'll get into this demo. If this will let me do that. There we go. And can everyone see my screen? Great, thank you so much. So once you get to directcarecareers.com, this is the screen you'll be directed to. So on the right, you'll see a few different states. So we are doing this with North Dakota, Pennsylvania, and Texas. Direct Care Careers was born out of the American Rescue Plan. And so we're fortunate we're able to continue it now. So if you go to Colorado and click there, it'll take you to the login. So for employers and providers, there's a drop-down caret here, and there's a little bit of information. So you would want to complete the required fields indicated with a star to confirm your status as a registered HCBS provider. And if you need any help, or if you put your information in, your name, your tax ID number, and your zip code, and that information comes back as invalid, the first thing you want to do is just go to Health First Colorado, and it's kind of what Brooke was talking about at the beginning here. If that information is not up to date, like if you moved since you had submitted that information to the state and you have a different zip code, you might not be able to access the site. But going to Health First Colorado will help you verify that. Everything, all the fields are case sensitive. So if your name has an ink on the end of it and it's a lowercase I, you'd want to put it in exactly like that into the website. And for your tax ID number, you don't want that dash in there. It's just those 9 numbers. So once you do that, you'll be able to sign up and verify. So I'm going to go in and log in as an agency. And once you log in, this is the sort of landing page that you'll see, which is my workspace. And you can come in here, account details. That's just basically what you see here on the My Workspace page. Edit my account. If you come in here, you can upload a picture or a logo of your agency. So that's just another way for people to identify who you are if they're looking for work, and put your name and update your name, first name and last name, excuse me. Email is a little bit trickier. If you can put any email in when you first log in, and that will be the email that you will have to access this website and where all of the information for this website goes. So we do like kind of weekly blasts, or not weekly blasts, but we do campaigns if there's information that you all might need to know. So if you want that to go to a different email, you'll have to just reach out to us and we can kind of change that on the back end. And also to reset passwords, you can access here. You will be asked to reset your password every 40 days. That's just industry standard to make sure we're all good. And if you go to My Job Posts, which is the next section, I'll just give it a little bit of time. You will see all of the job posts that you have created. And let me go back. So to create a job post, let's start there. You can go to add a job post or add a job post template. So these are kind of 2 different ones. If you're someone who has a lot of turnover and you're constantly sort of putting job notices up for the same sort of position, you can actually create a template so that you're not going through and having to do an entire job application or job post from scratch. That just kind of makes it easier. Otherwise, you can go into add a job post. And so from here, you will go in, add the name of the job, how many positions are available for that job, and where it is. And we'll go through this here in a second. I'm not going to go through every single category here, but you kind of get the idea. So when a worker is adding their resume and their information, it's really mirroring this. So it's very similar to what the provider is putting in. So we have all these like really neat text or check boxes on here that you can come in and just come through and say like, oh, I need food preparation, housekeeping. And so that will help you just kind of quickly fill this out for types of services needed. However, if you're going through this and there's a type of service that we do not have listed here, you can come to this text box, put that type of service in there, and it'll show up on your job posting. So we also have minimum qualifications to go through, and credentials and things of that nature. Let me get back to, sorry for the scroll here, My Workspace, and we'll go to our jobs again. And so you can actually see a job post that I've kind of mocked up for this demonstration. So I'll scroll down, and if you go to the bottom, you can see the more, and we just want to see the full job description by doing that. So we have a couple of options here. So at the end of creating a job post, you'll be asked if you want to publish it or not. So if you want to publish it, that means that workers are going to be able to see and will be matched to this job posting. If you don't, say you got halfway through the posting and you have to save it, but you don't want it published yet because it's incomplete, you can go ahead and just leave it unpublished and come back later and publish it so folks can see it. We do have a new feature that we started here back in January, and that is we were getting a lot of buildup of sort of older job posts. So we wanted to make sure that all of the job posts were live and active on the website. So what we did was we set up sort of a timer, basically, where after 30 days, you'll get a reminder email saying, like, hey, we see that this job posting is still open. If it's not, please go on the website, take it down. If so, no action needed. And then it does that same thing again at 60 days. And then at 90 days, if the job posting is still on the website and no action is taken, it'll automatically be unpublished. However, great thing about that is if that is an error and you want this to be still remain after 90 days, you can come back in, click renew job post, and it'll republish it immediately. So it's easy as just one click. And you can also come in and close your job post if you've hired someone or if the posting is closed. So this is what it kind of looks like to a worker who comes in and is looking. We have all of the information here of like the job type, where it's located, languages, the qualifications and credentials. We also have a section for benefits where you can just click through and choose what benefits you would offer. And also who are you providing support for? So like children or adults or older adults, and also kind of what services need to be provided for the needs of that individual that we have this job posting with. We also wanted to make sure that everyone knew kind of what the environments that they were going into. So in this instance, they're going to be cats and dogs. So if I was a direct care worker who was allergic to cats, might not be able to go into this environment, I would be able to see that right there. And then we also have the pay scale here down at the bottom. So as I was talking about with the auto matching, we'll go here and look at it. So I've already selected screen candidates. So this is someone we've added to this. So there'll be multiple cards. I don't want to show you all the other ones because there actually are candidates. This is one I made up. So you can take them off or add them by clicking this little person right here. And then it kind of gives you just a real quick breakdown of this individual, what their role or position they consider themselves as. This is a direct care professional, how many years of experience, availability, where they are in the world. So that they're nearby, and when they last updated their profile. We also have these icons down here. So if you hover over it, this really just shows how they were matched to this job posting. So one, they were chosen based on location or proximity. So this job posting was for Steamboat Springs. This candidate lives in Steamboat. If you go over to the availability, they had the same availability. They were looking for full-time work, Monday through Friday, 9 to 5 type of job. And then this is basically what types of services they matched on. So you can see that little 3 in the circle. That means they matched on 3 types of services. And then the last criteria that we have here is by gender identification. So if you want more information on this, other than this like really quick card, you can go to the view their profile, and it will take you to their profile where you can see their dashboard and their information and look at sort of trainings taken and all that good stuff once we get that badge feature up, which will be coming soon. I'll talk about a little bit later. We also have a view resume. So if this person uploaded a resume, you can come in here and download that. And if you're a paper person, you can actually go in and print that resume out from this section. And we also have a contact me section. So all of the correspondence will be done on the website. So you're not going to be emailing outside of the website. And this is just basically, so if we came here and we saw Casey and we thought, hey, this person seems like a match, we can go to contact them. And then we have all of our messages in template form. So for this, we're just going in for an initial interview, and it'll come up with a template that basically says, choose some dates and times to offer this person to have a call with you regarding the job. And so you can come in here and just choose a couple of dates and times. And once you've done that, you can preview. Right, you can preview the letter. So this is what it looks like when it goes out to, oop, I missed something. I might have a little glitch on the old demo site here. Stick with me for just a second. I think it was because I didn't put in the AM PM. We'll get there. Just stick with me for a second, and there we go. And then we'll come up with basically saying, we came across your resume. We're interested in discussing the direct care worker role with you, and these are the times that are available. And so on the other side, for Casey, once they receive this, they can go through and in a different template and accept these times, or if none of these times work for them, they can propose other times. So, and then you kind of do that back and forth until you get that set up. I'm just going to go back real quick to our card. So at that point, we would say we have interviewed the candidate. And so this drop down here at the bottom is really, excuse me, sorry for the scroll again, is really for you all to be able to track where you are with someone. So if I had sent that out and I'm just waiting for a response, I can say that. Or if the candidate isn't a fit, just so you know who you've interviewed, who you haven't interviewed, and where you are in the interview process. And it's really important for us that you kind of finish the process of the hiring. That gives us really great information, and it really shows where we can show through our reports the effectiveness of the website and showing that people are using it to hire folks. So if you can do that, would be really appreciated. We are kind of working on incentives. One idea that we're kind of throwing around, seeing if the vendor can do it, is to say to anyone who hires a direct care worker through the site and finishes that process of the hire could potentially be sort of pegged as a verified hire, saying this person, this agency has hired people on this website. So that would hopefully draw more people and more workers to your agency. Next up, I just want to quickly go through the resources. So this is our resource page. We have loads of resources. As I said, I come on here every week and load new ones. We have resources for direct care workers that are for, you know, finding insurance, finding childcare, housing resources and things like that for their personal lives, but also for their workaday lives. So like how to prevent falls, like if you're working with someone and you need a resource for transferring or something like that, we have those resources on here as well. We have some for agencies as well on like how to prevent burnout specifically for direct care workers. And we have, resources for CDOS employers as well. We have how to become a CDOS employer on here and how to go through all the steps to do that and what CDOS employment is, since a lot of folks might not be aware of that. On our resources, we have these handy little bookmarks here. So if you're an employer and you want to find something, as I said, on preventing burnout, you don't have time right now to look at it, you can click that little bookmark there, and this will actually show at the bottom of your My Workspace page. So you have that quick link. So there are a lot of resources. So if you want it, that's just one way we can help you keep organized. There's also a way to look at this through different resource types. So if you're looking specifically for a video or an interactive instruction, you can find those here just by whittling it down. And you can also look by topics and also the audience. So just a couple helpful ways to do that. Our collaborate feature is not up and going quite yet. So basically when I go on there, I can post the collaborate post saying like, hey, what do you guys think of this, and this? And then direct care workers can post on that. We're working with a vendor right now to get that updated, so it would be more of a forum for direct care workers to find assistance. Say if someone needed a shower chair for someone and couldn't find it at their normal closet that they go to, a durable medical equipment closet, if someone else knew one nearby or something like that. We also have the contact us section. So if you go to this, it'll just take you to basically an email where you can contact the help desk if you encounter any issues or you have any questions or any problems that arise. You can also go to the chat feature down here on the right side, and that'll be the same thing. It'll come up and you can chat with one of the individuals at the help desk. Going a little bit further down, we have the Learning Center. So if you haven't been to the website in a little bit, this will look a little bit different. This is the learning management system that we changed over at the end of last year. We have loads of courses on here that are, let me go to oldest. So that are for the Colorado Direct Care training. So there's about 30 modules in there, and this was based on the universal worker model. So we really wanted to make sure that it goes from someone who might not know what a direct care worker is at all. They might have just been introduced to it, so they can come here and find out the very basics of direct care work. And that goes, and as you go through the modules, if you go in order here, it kind of progresses and teaches you about observing and documenting and reporting, about safe member mobility. And so those are all of the direct care courses. And then we have two others. The others are foundational skills. So I'm just gonna filter this just to foundational skills. And these are really more sort of for not work-based. So if I'm a direct care worker and I want to hone my skills or like, you know, beef up my resume, there's a module in here on how to make your resume, how to interview, and things like that. So it's sort of those skills that you need as a worker that are outside your actual job. And then we have career paths in here. So we have 7 modules for career pathways. These modules are really for an individual who's a direct care worker, but kind of wants to find out how to become, like, to grow within their role. So they don't want to be a direct care worker forever, but they want to stay in the field. So this really kind of shows like what direct care work can lead to in the future. So we have surgical technician or phlebotomist and or respiratory therapist in here right now. So that really just gives people an idea of where they can go. So I'm gonna go back to my dashboard here. All of the modules, once they've completed, I think all of the direct care training modules have a quiz at the end. All workers have to pass that quiz with at least at 80%. And if they do that, then they will be sent a certificate of completion. So if they needed to show that they've had their HIPAA certificate completed, or they needed to send, you know, the agency that, you know, they've completed that sort of module, you guys can request that from your worker and they can send it to you. We're also working on badges. If any of you have been a part of like the collaborative or any of the action groups, you might have heard of our process and going through with that. So back in the autumn, we got together with an action group or a group of stakeholders, and we looked at all of the courses that we offer here and identified 3 kind of categories. And from those categories, we lumped a series of courses in with those. So basically, we're going to create badges saying that workers have completed this series of trainings, so that when you are looking for an employee or a worker and you go to their dashboard or look at their workspace, you can see very easily and quickly like what badges they have received and what kind of trainings they have completed on the website. We also have a new calendar on the website that we have trainings on. I post new trainings weekly on here. This is again in the demo environment, so it doesn't have all the trainings that are available right now. But you can come here to find, we have job fairs up right now. I've found some good resources, in-person resources on, help with taxes and things like that. So if you come and you see one, you can click on the title. It'll give you the more information, the full title, where it is, when, and a link to registration. Or if it's not online, it'll have the address of where the event is being held. So I'm going to stop my share, and I would like to share some sort of information on the website and where we are today with that. If you could bring up that slide for me, Brooke.
You bet. I am just getting it pulled up.
Thank you so much. All right. So right now we have a total of over 2,000 workers who have registered on the site. We have 148 active employers with 38 CDOS employers as well. We have had almost 10,000 people complete modules on the website, which is pretty exciting. And our top module by far is HIPAA and member confidentiality, followed closely by documenting and reporting. And our top resource within the resources is Medicaid 101, which is basically just a resource showing like what is Medicaid and just the basics on that. At this point, I haven't been able to see if there was anything popping up in the chat, Brooke. But if there are any questions in there, I can take those. Or if anyone has any questions, I'd be happy to answer anything about the website.
Yeah, so Daniel asked, do the DCW training courses count with the state as annual continued training for direct care workers?
They do not. So do you want to take that one, Heather? Yeah.
We can't say they do or don't. Let's say that. We are working with CDPH&E on, because they are the licensing agency and there are various classes of licenses in there, ACF, IHSS, like the home care. So hopefully by the end of this week or next week, we'll have some real definitive information from them. They're intended for our workforce, for our provider agencies to use, should they want to use them. So they count for that. But as an agency, you are required to have your own, you're required to understand how you need to meet individuals' needs and licensing training stuff. So what we're trying to avoid is saying, yes, this is the solve all for everything, because there's so many other things in there that need to be done. But we are working on getting you, everybody out the messaging so they can understand how to use the modules in their own training if they want to. Portability is ideally what we're looking for with those training certificates, but sometimes the portability needs to be very specifically defined in what they, so that's why we're working with the health department. I just got a letter from them today about that. So really hoping that we can put that out so folks can understand better how this works for them. Understanding that some workers are required to have so many trainings and so many hours of training every year, and which of these makes sense for that and not. Would really like to kind of flesh some of that stuff out. So TBD.
All right, Daniel says, very good, thanks. And then Tom asks, how do you see this worker database interacting with the IRSS/HH database that is being proposed? I'm not sure, John or Heather, if either one of you have.
I think it would be separate, Tom. This is broader for all waivers, CFC, all workforce, PACE, LTHS. We would need to see what that would look like. Like this is we pay for this, then access to this. That'll be different than what that is. I think once we maybe know a little bit more of what that would look like, anything on this site that is that could be linked to help connect the dots for training, for any of that stuff. I see it in that level, but this is not a Colorado, like it's not a HCBS owned platform, right? And so we're only able to do certain things with it. So anytime we can link or make reference in other stuff to get people to the source of truth quicker, we'd love to do that. So that's also, I'll make note of that. We'll kind of pay attention to how that's going, because it's not our team, but how it intersects so that we're not duplicating or repeating services. So thanks for pointing that out.
Perfect. Thanks, Tom. Thanks, Daniel. Any other questions for John? All right, John, we'll let you off the hook. Thanks so much for being here.
Yeah, thank you. Appreciate it.
All right, we'll move kind of into closing out the meeting here. So we do just want to open it up for a quick open forum. I know we lost quite a few folks right at the 2 o'clock hour. I think people haven't hopped to their meetings, but for the folks that are remaining here, if you have any remaining questions, any resources you'd like to share, we'd be happy to open the floor to you to speak out and share, drop links, whatever you see fit. So I'll just give the floor to the audience for a bit and see what we have. And feel free to just raise your hand or come off mute. There's not a bunch of people trampling to talk. So,
Brooke, if you don't mind, I was going to do a plug for Friday is the next Direct Care Workforce Stabilization Board meeting. So just awareness for those. I'll find you a link for that in a minute. And maybe some specific topics there that relate to this, and also what John just talked about is as of July 1st, 2026, HCBS providers have to inform their workers of the Direct Care Careers platform. And so it's going to be on the plate for providers soon to be aware of the site, to notice the site. There is the required Know Your Rights training that Colorado Department of Labor has to do. That's going to be required of our workforce. And it is likely this training will be housed on the Direct Care Careers site. So just putting that plug out there. If folks want to get in there and poke around now and get familiar with the site, and maybe introducing staff to the site, we always want to staff. The site is for different things: work, training, resources, and jobs. So you have active staff. We don't want folks being afraid their staff are going to see other jobs. They already know there's other jobs out there, right? The site is used for multiple things. So maybe encouraging a few of your workers or even yourselves to take some of the trainings on the platform to see how they are. It just kind of helps you prepare for July 1st when those requirements roll out. And I think there's maybe like a 3-month window where that training has to happen. So wanted to put a plug in for that. And I will find you the link to the stabilization board as well.
Perfect. Thank you, Heather. Just a couple comments in the chat. Tom, remote supports information and availability very timely given the rate cuts that we're facing. Just a nice comment there. Kim shared Beneficent has some hybrid Zoom educational classes that are available for clients that are worried about how to pay for long-term care without going broke. And she shared a link in the chat. So that's a great resource to check things out. And Heather did just drop the stabilization board link as well. Lots of good information. So what we'll do with all these wonderful links that are being dropped in the chat, we really love our chat on here, but I'll collect all of these and make sure that are linked in the slides as well. And so you have access to these as well. Daniel, please.
Yeah, Heather, I just wanted to ask a real quick question just to make sure that I understood. So you said July 1st, it will be mandated that all of our staff are made aware of this website. Did I hear that correctly?
Yeah, yes, this is very specifically the Direct Care Workforce Stabilization Board recommendations. They ran a bill last year. And so that's, so it requires HCPF to do some stuff. It requires Colorado Department of Labor and Employment to do some stuff. So that, I wonder if it's on that site. I was going to look on that site to see if it's on there as well. The recommendations on there, I can drop the bill language in there as well, or the bill that outlines the different things.
Yeah, that would be great. Thank you.
Looks like Justin dropped the link to the bill in there. And Daniel, I don't know if you're connected to our Direct Care Workforce Collaborative, but I'll drop that link in the chat as well. We'll have some updates kind of in our action groups and our full collab leading up to that. Even if you're not able to attend the meetings, just keep an eye on the slides and stuff. We'll kind of continue to keep a pulse on that too. So just lots of meetings. We love it. because you just have all the time in the world to come to all these meetings. Perfect. Thank you, Justin. Appreciate dropping the links there. All right, I will move us just to this final slide here, just a reminder of upcoming meetings. So we do have our next community of practice Monday, June 8th at 1 p.m. So I'll work with Casey and Jesse to get some additional remote supports information, but we will likely have some agenda time available. And so I'd encourage you, if there's something you'd like to see, to fill out our topic request form, which I'm going to drop in the chat. We'll be live on this slide when you get them posted as well. Anything you'd like to see for this space, we're open. That's how remote supports came to be. That's how direct care careers presentation came to be. We take those requests. We don't want to prescribe anything for you or have you show up to a meeting that you didn't want to see. So we'd love when you provide those topic requests for us so we can bring information that's relevant to you. And then our next Direct Care Workforce Collaborative will be Wednesday, April 8th at 10 a.m. That's going to be during our Direct Care Worker Appreciation Week that we have through the state legislature. So we're going to be doing some highlights of some direct care workers and some nice messages and things. And so if you're able to join us for that, we'd love to have you. The agenda will be posted on the collaborative website shortly. I usually try to get that up about 2 weeks before that meeting. So it should pop up in the next couple of weeks there on that website. And then we do just have some resources that we'd like to share out. Our rural sustainability page, our OCL stakeholder engagement calendar, that's for all of the Office of Community Living. So it's all of our workforce projects. It's this project. It's anything that's happening within the Office of Community Living. They've had a lot of stakeholder engagement opportunities, providing feedback on all the changes at the state and federal budget levels. And with that, I'd like to star those two: understanding the impact of federal changes to Medicaid and Medicaid sustainability in the Colorado's long-term services and support system. Those are our communication pages where we're continually kind of updating as things happen in those spaces. And so good websites to just bookmark for you to kind of keep. Again, we just trying to keep the information that's all coming at us very fast in one place for you to be able to keep a pulse on things. So bookmark those and then let us know if you have any questions there by emailing us. And that is my last slide. So I just appreciate y'all hanging on. I know it was a smaller meeting today, but I feel like we had a lot of really great information, a lot of great engagement. Really grateful for John and Casey for coming to provide information, and we'll make sure that we get you what you need come June. So thanks for being here. Thanks so much, and we will see you next time. Have a great afternoon. Appreciate you. Thanks, Tom.